FunDaMed EyeDrops, EyeDrop Prescriber, Reminder Tracker and Monitor by Dr. John Akkara.
Yes, sir. So I am Dr. John Davis Akkara, and my innovation is an app. I call it FunDaMed EyeDrops or FunDaMed QRX because it uses QR codes. So ophthalmologists diagnose several diseases and treat them by prescribing eye drops. We think that is the end of it, but that is not the end of it. The important step is the patient should use the eye drops correctly and follow the schedule correctly. That is often ignored. Many patients, they use the drops incorrectly or misusing them, and especially these tapering schedules of post-op medications, uveitis treatment, and also long-term glaucoma treatment. Whenever we change the medications, that is very confusing for them. In the long term, such critical diseases such as glaucoma, every missed drop leads to permanently lost nerve fibers. So that is permanent. So even if patients find and install a medication reminder app, they find it very cumbersome to feed in the doctor's prescription into their phone. So there are two big roadblocks there: getting a good app, using it, and feeding in the prescription also. So the feeding in the data should be ideally done by medical personnel for accurate entry. And our approach is to solve all these problems at once by using QRX technology. So that is QR code and RX prescription. So what we do is we create an easy to use app for doctors to prescribe eye drops with error prevention also built in, so that if you cannot give a wrong dosage, it will give an error message, and also to transmit that prescription to the patient's phone using a QR code. Why QR code? Because it is quick and fast. Then when the patient scans this QR code, it opens or installs the app for them and then loads this prescribed QR code medication prescription into their phone. And this app can provide reminders and track the medication adherence on a daily basis, and later they can share it with the doctor at the next visit in case of privacy concerns, or if they want to, we can maybe in future have a direct sending of the data to the doctors. Patients can also update their symptoms. So if they have some side effect to some particular medicine, they can immediately update on the app: I am having redness and irritation when I put this drop at this time, so that they don't forget it. It comes on the timeline of the doctor's information. And also any other symptoms, any other side effects can be noted. So this will help in foolproof medication for all these diseases such as uveitis, post-surgery, glaucoma, corneal ulcer, and all these, everything which needs proper medication. So app concept was designed, modified with a good interface was planned, and functions include prescribing for the doctor, receiving prescription for the patient, then reminding, tracking and monitoring by alarms on the patient side. And possible drug interactions and contraindications, systemic diseases, all those were also planned to be introduced into the logic of the app. And existing medications, whatever is easily available, that database will be entered, but can be also updated by the patient or doctor. This is what the app looks like. So it will have this doctor-patient separate login page. So once you go into the doctor page, you will have to fill in the patient information and also the medication information. In addition, you can also do tapering medication. Then you click generate QR code, and then you get the QR code, and then you can show the patient their app. They open the QR scanner and load this QR code into their app, and they get the prescription on their phone. And that converts into alarms on the patient side. So that is basically what the app is supposed to be. So it's supposed to be an easy to use app for prescribing, receiving medication prescription, and tracking. So that is what I would like to present. Thank you.
Thank you. Can we have the question?
Very innovative idea, but can you have this even on a computer, the app, or is it only on a smartphone?
So it's basically a web app, so you can have it on a computer as well. It will be HTML based, so it will run on a browser. Chrome, it will run on Chrome.
Okay. Because what I would tell my patients now is to set an alarm on the clock, on their phone.
Okay.
So that
okay.
every time that you have to have a
So you can make sure that they set the alarm correctly. Because if you have an EMR, I have not yet integrated this into an EMR. So if the EMR company allows, I would like this to be part of the EMR prescription setup. So once the prescription is done, generate QRX. So QR code treatment, it will just generate a QR code. Patient will just scan from the EMR screen itself. Can be a laptop, can be a tab, can be a desktop. And immediately the correct prescription goes into their phone. You don't have to worry whether they set the alarms wrongly. And also it will show the medication, which one is supposed to be administered. So it is much better than an alarm. And also the tapering doses can also be set. Alarm cannot do tapering doses.
Is there a way that you could put a photograph of the drop?
Yes, sir. Yes, sir. That's what. So on the alarm, it would show the photograph of the eye drop. So that we have to customize that. You have to take a photograph of the bottle and put it. Right now, the database has to be put separately for all these medications. So pictures have to be added separately. So the alarm will show which bottle they have to use.
And what is the cost of your app?
So I want to make it absolutely free. Cost of developing, there is a small amount, but if we keep it paid, nobody will use it. I want it to be free.
Very, very good idea.
Thank you, sir.
Thank you. I'd like to request sir to please give a certificate to